Welcome to The Explainer. Today we're diving into a really painful and confusing medical condition, one that often hides in plain sight. We're talking about a disease where the body's own protectors, its immune system, actually turn into attackers.
So, to really get a handle on this, let's start with a pretty strange and sudden medical case. It really shows you just how bizarre this whole thing can be.
So picture this. A 58-year-old man, he's already in the hospital, fighting off a really bad case of COVID-19. But then, something else starts to happen. A totally new and alarming set of symptoms that have absolutely nothing to do with his lungs.
All of a sudden, he can't lift his right foot properly. Then he gets this numbness and tingling in both of his arms. And on top of that, a painful purplish rash just erupts on his leg. Meanwhile, his blood tests are going haywire, showing his body's inflammation is just spiraling. It's this really weird, lopsided pattern of things going wrong. Okay, so this is where it gets really interesting. That rash on his skin, it was more than just a rash. It was a clue, an external sign that pointed doctors to a much deeper problem, something hidden way down in his peripheral nerves. It told them the attack wasn't random at all. No, it was targeted.
And this classic pattern actually has a name. It's called Mononeuritis Multiplex. Now, this isn't some general problem where all your nerves get hit at once. Not at all. Think of it more like a city's power grid, but the power starts failing in completely random, unconnected neighborhoods. First, a nerve in your leg goes down, then maybe one in your arm. It's this painful, patchy, unpredictable attack.
So the big question is, what could possibly cause such a specific, damaging, and frankly, weird attack? Well, the answer is kind of ironic. It lies in the very system that's supposed to protect us, our own immune system.
The culprit here has a name, vasculitis. And here's the best way to think about it. Imagine your body's own defense system, your immune system, just going rogue. It gets confused and starts seeing your own blood vessels as the enemy, as foreign invaders, and so it launches this full-scale assault on its own infrastructure.
And wow, this image really gets right to the heart of the problem. What you're looking at is a cross-section of a nerve. See that blood vessel? It is literally being choked by inflammatory cells. And when that happens to the tiny little blood vessels that are supposed to be feeding your nerves, it's like cutting off their fuel line. It starves them of oxygen and nutrients, and eventually the nerve just dies.
So when this whole process, this vasculitis, specifically targets the nerves outside of your brain and spinal cord, your peripheral nervous system, that's when we call it vasculitic neuropathy, or VN for short. But here's the tricky part. This one disease can wear a lot of different masks, which makes it incredibly hard to pin down.
Okay, so this is probably the biggest challenge with vasculitic neuropathy. It just doesn't look the same in every single patient. The symptoms can be all over the map, which is why a lot of experts believe it's massively underdiagnosed.
You see, the disease tends to show up in one of two main ways. On one hand, it can be part of a bigger, systemic problem that's affecting multiple organs all over your body. And if you don't treat that, it can be fatal. But on the other hand, it can be mysteriously contained, isolated just to the peripheral nerves. Now that version isn't typically deadly, but it can still cause really severe, debilitating damage.
And this right here is so important to understand. What starts out as that very distinct patchy attack on individual nerves, well, over time, it can spread. It starts to converge. The symptoms begin to overlap so much that eventually the condition starts to look like a much more common symmetric neuropathy. It completely disguises its true identity.
And because of all these disguises, this sort of chameleon-like nature of the disease, the delay in getting a diagnosis can be just extreme. Get this. In some reported cases, it has taken up to 13 years for a patient to finally get the right diagnosis. 13 years.
So that's the million-dollar question, right? How do doctors cut through all of this confusion? How do they sift through all the symptoms and finally unmask a disease that is just so good at hiding?
Well, the first step is basically a process of elimination. Doctors have to rule out this huge list of other conditions that can cause similar kinds of nerve damage. And I mean, the list is long. It covers everything from infections like Lyme disease to genetic disorders, even cancer-related syndromes.
Okay, so after they've ruled out all those other possibilities, what's left? Well, the gold standard, the absolute best way to get a definitive diagnosis, comes down to three crucial steps. First, they pinpoint a nerve they know is affected. Second, they go in surgically and take out a tiny little piece of it. And third, they look for the smoking gun under a microscope, that direct physical proof of inflamed blood vessels. They have to catch it in the act.
All right, so once the disease is finally unmasked, the fight begins. The goal is simple, but urgent. You have to slam the brakes on the immune system's attack and stop any more permanent nerve damage from happening. The primary weapon in this fight is immunosuppression. We're talking about using drugs like high-dose steroids to basically tell the body's overactive immune system to just calm down. But what happens when that doesn't work? Let's look at a really cutting-edge approach that's being used for severe cases that just don't respond to the standard stuff. So check this out. This was a study for patients with a particularly severe form of vasculitis. For these people, the usual treatments just weren't working to stop the nerve damage. So researchers tried something else. They gave them a treatment called intravenous immunoglobulin, you'll hear it called IVIG, to see if it could finally turn the tide.
And you know what? The results were pretty remarkable. The IVIG treatment led to this significant boost in what are called regulatory T cells. The easiest way to think of these TREG cells is like the brakes for your immune system. At the start of the disease, these patients barely had any. But after the IVIG, their numbers just shot up, and that helps slam the brakes on that self-destructive attack.
And that brings us to the prognosis, which is actually really promising. With today's aggressive modern combination therapies, up to 82% of patients can regain or at least maintain the ability to walk on their own. I mean, that's huge. It's a real testament to how effective the treatment can be once you finally figure out what you're fighting. But there's a catch. Even when you get the disease itself into remission, a kind of shadow can remain. The thing is, for a huge number of patients, we're talking up to 71% in some studies, managing the chronic nerve pain that gets left behind becomes a whole new lifelong battle.
And that really brings us to the most crucial point of all. We have treatments that work. We know how to fight this disease. So the real frontier, the biggest challenge that's still ahead of us, is just getting better at seeing it in the first place. The big question we're left with is, how do we shorten that devastating, years-long delay between the very first symptom and the right diagnosis?